Hey, good morning, friends. How are you all today? My name is Dr. Gaurav Chawda. You can call me Dr. Gaurav. So, let me introduce a new topic regarding IVF. So, today we just introduce what is the female reproductive tract. So step by step, for 1 year or 2 years, I just introduce all the IVF topic in English, with a easy English, with a layman English, so anybody can understand what is the problem behind infertility treatment. So let's start. I gonna explain you how to understand or introduce the female reproductive tract. So what is meaning by female reproductive tract? Well, when it comes to female reproductive tract, it is the organ system inside the female body in a pelvic region or below the stomach area, in which a recreation, reproduction, or to conceive a new baby, that all the procedure inside it happen. So I just go through all the topic, and this is the female uterus. Uterus means an organ and a cavity inside which a male and female gamete combined and became an embryo, and then it implanted inside in it. Well, when it comes to fallopian tube, it is a tube-like structure on both sides of the lateral side of the uterus, from which male sperm travel up to the ampulla region, and same time female egg is also ovulate and come inside by the catching that embryo, and with the help of femoral hand, and then come inside, travel inside, and they met at the ampullary region. If the embryo is fertilized, then it once again travel back to the uterine fundus region or uterine cavity region. So that is the bridge area, helping as a bridge for the gamete of the male and female. Third thing is a female ovary. In ovary, the ova or female gamete is produced up to the age of normally 35 or 40 or 45. I don't know, it may be differ from different ladies according to their body structure and all the hormonal structure and etc. So it is an organ of ovum production. If it is not properly worked, then there may be chances of ovarian failure happens. Same time, if you have any problem in the tubal blockage, or hydrosalpinx means pus in the tube, at that time there may be a chances of normal conception not happen. So everything about tube, ovaries, and uterus. In uterus there may be chances of non-malignant tumor-like structure. There may be it may be a fibroid, there may be a septabroad or didelphus or biconvert or uniconvert, or maybe a uterine TB or uterine chlamydial infection. There may be chances of PID, there may be chances of endometriosis, and there are many more conditions happen to prevent a normal pregnancy. Don't worry, I know that all the terminology are new for you, but for that introduction, you just keep watching our video, so I can introduce one by one terminology in the form of TB of uterus, chlamydial infection of uterus, PID of uterus, fibroid of uterus, etc. These are all the terminology uterine patient come to know. Now, third one is mouth-like structure. It is normally known as the cervix, and the mouth is known as a cervical lip. And there may be chances of some cervical diseases like dysplasia or squamous cell epithelium, etc. These are all the abnormal conditions which lead to the like cervical problem. And lastly, it is a vaginal canal in which through the process of the parturition or the birth process has been started. Normally, there is no role of vaginal canal in case of reproduction, for it is an organ of copulation and intercourse. But there may be chances of the dyspareunia, which is one of the most common cause for the infertility. As you know, there may be a psychological and psychosomatical disorder, or there may be a mental trauma, or there may be any other reason in previous life. So at that time, there may be a mental trauma which lead to the dyspareunia. It is a painful intercourse, and there may be chances of not normally relation happen during this procedure. So nowadays, it is one of the most common cause for the IVF requirement. So this is the all basic introduction. Don't worry, it is only for just introduction. Whenever you come to know anything new, you just confused at that time, but within short period of time, when you repeatedly watch our videos, we both came across this type of all the terminology, and I explained all the things briefly, so and deeply and thoroughly. So now, my dear friends, with this I completed a short introduction, a brief introduction of reproductive tract of female. If you have any question, you can feel free to ask me. So once again, thank you so much. And lastly, this is a series of videos. We try our best to continue till 1 or 2 years or till lifetime, so you can easily access through the reproduction programmation. So I think I made it as simple as possible. As a layperson and not as a doctor, I try all the layman terminology in it. So this is all for today, and this is Dr. Gaurav Chawda, behalf of MADHUDEEP IVF and Test Tube Baby Hospital, and our mobile number is 9974864644. Our IVF center name is MADHUDEEP IVF and Test Tube Baby Hospital. The address, the location is Straight Transport Stand, ST Bus Stand, Panwadi Chowk, opposite Peel Garden, near Bajrandas Hospital, Bhavnagar. It is a city, and Gujarat is a state. Our pin code number is 364001. We have a very attractive and very appealing offer for people all over the India and infertile couple. IVF, we just done IVF with 31,500 rupees, including injection, egg pickup, egg retrieval, embryo process, and then embryo transfer process. So that's all for today, and if you have any query, you just write down below comment box. But I just want to tell you that, and it's my humble request, don't write any nonsense or stupid thing in the comment box. You just use as to know a new thing. So thank you so much, and have a good day, and goodbye. God bless you. Thank you.